In this episode of Quick Hits, we're excited to host Crystal Broj, the Chief Digital Transformation Officer and Executive Director of Digital Solutions at the Medical University of South Carolina. Known for fostering collaboration across clinical, business, and technology stakeholders while driving innovative solutions, Crystal excels in strategic direction and project management across her decades-long career in healthcare. As a C suite IT leader with strategic insight, Crystal adeptly translates corporate strategies into actionable plans. Today, Crystal will share lessons in effective leadership, managing complex projects, and driving technological innovation using Epic's EHR and other related tools like Notable. What I particularly love about this episode is when Crystal takes us through her ideal patient experience in a perfect world. Now, on to the episode.
And welcome to another episode of Quick Hits. I'm your host, Ken Booth, joined as always by my co-host, Tyler Smith. Tyler, how's it going today?
I'm doing fantastic, Ken.
Glad to hear it. Always glad to hear that. Today we have a great conversation, actually. We're talking to Crystal Broj. She is the Enterprise Chief Digital Transformation Officer at the Medical University of South Carolina. Crystal, welcome to the show.
Hey guys, thanks for having me.
Yeah, absolutely. We're looking forward to this conversation. Before we get started, I was hoping you could give our audience just a brief background.
Yeah, of course. I started out actually programming way back in the day and then sort of moved up into consulting and then to business analysis, then directing business analysis areas at both Zurich Insurance and Midtown Athletic Clubs in Chicago. Then moved to the American Association for Diabetes Educators, where I was their Chief Transformation and Innovation Officer, and then to North Shore University Health System in Chicago. And then the opportunity to move to beautiful Charleston came up, and I moved down here and am now at Medical University of South Carolina, where I started our first digital transformation office. And it was just me for a little while, but now we have a team of 9. So moving strong and doing some really cool things in digital transformation.
Glad to hear that things are going well and your team is growing. So let's talk a little bit about your team and what you guys are doing. You've led numerous initiatives to kind of foster this innovation within the healthcare IT space, helping to integrate solutions, technology solutions that address business challenges. I was hoping you could share an example of maybe a project where this approach really improved patient outcomes.
Yeah, so one that I'm really proud of is our robotic process automation. We're using a tool called Notable for that. It actually will go out and say, oh, Ken, you've got an appointment coming up on Thursday. So it sends you a text message, has you log in and says, okay, well, you can check in or you can cancel it if you need to. You can put in your insurance card, your driver's license, all your information. So that's all done way before you get to the appointment. And then you don't get the dreaded clipboard when you walk in. I mean, you can even pay for your appointment up front if you like. What's great about that project is not only do you get a reminder that says, hey, your appointment's this week in case you forgot, which does happen when you have to book appointments out 6 months in advance. But it also increased our check-ins by over 30% that happened before and what happens now. We have decreased our no-show rate by 11%. So the great thing about that is you confirm, so then you're more tied to checking in. But also if you do need to cancel for some reason, we use Epic's FastPass, which will automatically book that appointment out for another time, for another patient, so they can get in to see people sooner. And we've increased our copay collection by about 15.5% as well. So really good numbers on that. But the better thing about it is the stories that we get from patients saying, wow, this is really easy to use. Thank you so much. And then we read all the comments. So we got some stuff back that said, hey, you know what? I get 3 of these because I have a lot of appointments a week. I said, could it be easier? And so we ended up consolidating appointments. So you check in once if you have any appointments during the week, which is wonderful for patients. And then we did it in Spanish, and we have over 1,000 patients a week that are checking in Spanish now, which is fabulous, where they probably would not have done the work before. And we embed patient instructions for different departments, go to the 3rd floor off the elevator, turn right, things like that. We can now take open balance partial payments. And so it's just we can register them for various other programs like our DNA Helix registration, which kind of looks into, some of your blood work to see if you are predestined for certain diseases and so on. So all really good stuff there. Then we took that just a little bit further and we started doing care gap outreach. Our first one was it with breast cancer. And so we outreached, as you guys know, a lot of people let their healthcare go during the pandemic,
Hmm.
and it hasn't come back as much as you might think. It's just kind of fallen off of people's radars, that annual visit, that, going for your mammograms, doing other tests like that. So we started reaching out to patients who have not had their mammogram in over a year. The first time we did it, we got some very interesting results because even though we had the appointments available in radiology, some of our regional health networks, they weren't ready for the volume of patients that actually wanted to come. They were so excited that somebody reminded them and made it easy to just schedule on their phone straight from the notification that they thought the system was broken. So they called and like, you got to turn this off. Your bots are going crazy. And that wasn't the case. Actually, we really just had that many people who really wanted to do that. So we did do some adjustments, made sure that they had the staff to be able to reach out if there were abnormal findings or anything, made sure the workflows were all working, turned it back on February 15th. Overnight, we had 140 mammograms scheduled
Wow.
without any help from
Wow.
anyone. We have had over 2,500 appointments scheduled to date, almost 700 that have been completed already. And from that, we've had over 100 abnormal findings. So, what that means is the mammogram found something and they need to come in for something else.
Yeah.
And so that's 100 people's lives that we've touched and possibly saved because they came in and got the check when they needed to, found something, and are doing something proactive about it for their health. So if that doesn't give you chills, because every time I say it, it gives me chills because it's like we actually helped people have better lives.
Absolutely. So it improved, I mean, obviously improving patients' lives, but improving business as well, just to have that many people who are able to check in easily. And I really like the streamlining of check in once for all of your appointments this week. That's incredible.
Yeah, it's been very popular. We're very pleased with the program. So we're going to extend it. We're going to do other well visits. This fall, we'll do our vaccines for both children and adults, just to remind you that hey, you should probably come in and get your shingles shot. Or you probably should come in and do your flu or whatever, as well as diabetes, hypertension, a few other ones, just to make sure people, they like to get reminded. Sometimes you forget. We're all really, really busy. So
Mm,
sometimes you forget to take care of yourself. And this is just a nice way to give a nudge to remind folks.
sure. Sometimes we always focus on the results and how great it was, but I just want to talk about the challenges a little bit. Did you face any challenges in implementing this software?
Implementing, we were really smart. I think we did it in phases. So we did 5 offices, then we did another 5 offices, and we sort of phased it through and then learned from each time we went through it and modified the process, figured
Mhm.
out where things were clunky. A lot of change management with that, letting people know what to expect, keeping people apprised of what was happening, and then following back up. What we did find, and we found it from patient comments, because we give patients have the right to do a thumbs up, thumbs down when they've finished the experience. And most patients, about 97%, give us the thumbs up, which is awesome. But then, even then, a lot of them put in comments going, why do you ask these questions?
Mhm.
You guys should know this. This hasn't changed. I'm still married. I'm still a veteran. Why do you keep asking these questions? So now we have changed the process. So we only ask certain questions once a year, assuming that. But what we found the most of all is that it was the hardest to change people's reactions and not patients,
Mhm.
staff,
Mhm.
because they still would hand people the clipboard. It's like, well, but I checked it online. Yeah, well, doctor likes the clipboard. But that just makes more work for them because they would then have to take what's on the clipboard, validate what's in the system, or type it in. And the patient gets frustrated because they've already done it online. Why did I go through all the work of doing it online if you're making me do it again? So definitely some things to, work to improve so that the overall, we call it phygital, from the physical to the digital and back again, becomes very smooth.
That's a really great example because I was about to ask you about the challenges in integrating new technology, not just into the tech stack, but into the workflows. And Phygital would love to hear more about the process of how you all came up with that neologism and how you got that message across to the team.
Well, it's not mine. It's from a company called Avia. They introduced that term to me, and it just sticks, right? You want everything to feel the same, whether you're in person, you're online, you're on our website. And that's something we're continuing to work on so that it's smooth all the way through. But we've actually are upping our game in the change management space, because, those front desk people, they turn over. And then you have to teach them all over again what this program is, what this program is. Doctor has an ambient device. So, make sure you tell if a patient hasn't interacted with that before, that doctor will be recording the session. They have the right to say no. Or, you don't need to give the clipboard to Mrs. Smith because she's already checked in. You can see this green dot here. So we're actually putting together some training videos for new staff members, new care team members, so that they can, learn about the technology ahead of time, as they, just like they learn Epic, just like they learn everything else. They'll also know the different digital tools that we've put into place. This is how the Notable works, and they'll actually be getting a message. So you can let them know after they schedule their appointment that the week before they'll get a message, and so on.
Notable, amazing product. Dr. Neinstein's been a friend of HDM for a while. Actually, we used to work with him when he was at UCSF, and he spoke at some of our events before. But, that brings the question of, there's a lot of digital health products and services out there. A lot of them can produce amazing outcomes, as you've spoken to notables. But curious to how you, as a C-suite leader at an incredible institution like MUSC, stay abreast of the technology, how you evaluate the technology, and how, it basically goes from sourcing to implementation.
Because things change so fast, we really have to stay on top of it. We belong to a couple different user groups, Avia, the Academy, the advisory board. So definitely get a lot of information from our friends at all of those places. Make sure we hit Vive every year. It's my favorite conference for learning the really cool new stuff. But then, of course, because your name's out there, you get a lot of vendors that call or text or email over and over and over again, saying they had the latest and greatest new thing, right? And so we have a roadmap. We put together a roadmap of what we wanted to work on this year, next year, and the following year, so we can evaluate, is this something that is on our roadmap for any of these 3 years? If certain tools, certain things that we might be looking at, a new app, for example, isn't on our roadmap till year 3. So as you hear about all these vendors and say, oh, I've got this, not quite ready to even explore that yet, not going to take my attention away from the things that I'm working on today, but also needing a problem before I get a solution. We get a lot of solution companies that come and talk, or want to talk to us, or talk to our staff or our doctors or whatever. It's like, until we know that we have a problem in that area, we don't need to be solving for something, because we can't buy everything. We don't have time to implement everything. And so we have to prioritize all those things. We have to see what we have, baby on board first. Like, we have Epic. Can Epic do it? We have Notable. Could Notable do it? We have Andor for virtual and some digital front door. Could they do it? And if any of those companies can do it, it's a lot easier, because we've already built around the tech stack. Than buying the new shiny unicorn, right? Everybody likes a new shiny unicorn, but sometimes we have stuff in house that will do what we need to do, or we need to push those partners a little bit to go, could you stretch and do this, instead of picking something new.
Yeah, that's such a good point. And I always ask digital health companies, what do they understand about Epic's current capabilities when they're building, something that might just be functionality. So, yeah, I do always wonder how, systems evaluate whether to build versus buy an Epic. And I guess maybe that would be my follow-up question is there a process for how you all look at the existing technology at Epic, or what's about to be released, versus what you could buy in a third-party application?
Yeah, I'm really lucky. Our BFF at Epic stays tight communication with us. So we talk often about, I'm looking at this, or I'm thinking about this. What is Epic going to have? Is Epic going to have a voice bot chatbot at some point? If so, how will that work? Will it just work with Epic tools? Will it work outside of Epic? Things like that, so that I can make a plan. Where is it on the roadmap? Is it somewhat near, or way future? We only sign contracts for 3 years. So, our promise to Epic is, we may take a spot tool now, but in 3 years, if you have something, we may consider switching over. So it really helps to have, really talk to your Epic resources, or any of your other partner resources, to find out what their roadmaps are, so that so that you can plan accordingly. And then, all roadmaps are roadmaps, but that isn't, real life. When we put together our 3-year digital transformation roadmap, there's this thing we did it in June, and then November, this thing, Gen AI, came out, and ambient technology came out, and a
Mhm.
few other things. And people were like, oh gosh, we've got to start doing that. What are we doing about that? Well, wasn't on my roadmap any of my 3 years, but what can we move in order to make room for that so we can start evaluating? We don't fall behind the curve because we haven't played in that space.
Well, yeah, and that kind of takes us into our next question then. So, how do you see the role of digital transformation evolving over the next few years? We'll say over the next 3 years, since that's kind of how far you like to plan out, but even beyond.
I think we're going to keep seeing incremental steps, right?
Mhm.
I mean, it's pivotal towards an efficient, accessible, patient centered future. And we have to keep the patient in mind. And a lot of tools started out being provider centric. Epic is very provider centric, it's very back end. It's how the hospital runs, it's how the doctors run and the cares team runs. But it's not, I mean, we have my chart and that's a patient facing thing, but it doesn't make it easy for the patient. There's a lot of tools that don't make it easy for the patient. And technologies like AI or machine learning will drive innovations in that to make that easier and better for patients. We're going to see things for diagnostic accuracy, treatment personalization, even predictive analytics for disease management, and that's going to come out. That sounds like, oh wow, you're going to be able to look at what I have and then in 3 years figure out that I'm going to have some blockage in my heart or something. Sounds like some science fiction thing, but it actually could be happening, right? And happening faster than we ever thought it would be because of how fast these technologies are happening. But getting those kind of things integrated, like we talked to in the workflow, is important with change management, being super key to that and being able to look at the workflow and go, can I from Epic jump out to a chart that tells me everything I need to know about diabetes for this patient so that I can really quick make a diagnosis and then come back and use my ambient technology to put it into the chart and say, Crystal, these are your next steps, for example. And then cost is a huge concern. We talk about where we want to go with the healthcare sector.
Mhm.
Hospitals don't have tons and tons of money. We're on a tight margin and we need to address our technical debt, the integration costs, the consulting costs to bring new software in. So those are things that we really, really have to worry about and work on as we try to do this. But I think the biggest thing we'll see is more and more things about patient engagement. I can tell you a little story about like Crystal's ultimate experience for a patient at some point is a full concierge service from primary care to a specialty referral. Doc, I've got a headache, something's wrong, let me refer you to a specialist. Before I walk out of primary care, we get referral to a specialist, and by the way, that appointment is scheduled when I walk out the door.
Mm.
Or if I need to have tests or whatever, those are also scheduled, or the tests are put in, they're verified by my insurance, and I get a notification that says, Crystal, it's time to schedule your MRI. And once you finish your MRI, you should schedule for your CT scan. And once you do that, then you should see Dr. Smith. And that appointment is scheduled for the 24th. So you should schedule these appointments within the next 2 weeks. And having all that taken care of before and very easily. And then if a procedure is needed after I see Dr. Smith, I check into the hospital, paperwork's already filled out, everything is done ahead of time. Instructions are sent to me, very easy. I check into my room. There's an Alexa in the room that turns on the lights and dims the temperature or any of those kind of things. And then there's a environment where, like, just with voice commands, I can have, say, okay, I'm going to have a virtual appointment with my doctor. Can I have my family member attend that and have that all show up on one screen so that because my husband's at work, he can't be there, but he could join a virtual appointment and talk to the physician. Follow-up instructions would automatically be delivered to my phone, including my follow-up physical therapy, virtual nurse visits, whatever. I would get a bill that I would understand. And it would already be completely correct with my insurance company filed, payment plan set up if needed. And all this happens to my preferred type of communication. If I prefer phone calls,
Mhm.
I would still get phone calls because no matter how digital we want to be, there's always going to be someone, my mom, who would rather talk on the phone than do it on her phone. She'd rather talk than type stuff into her phone.
Like AI generated.
Yeah, have voice bot maybe, or maybe sometimes you talk to a real person.
Yeah.
But as we take out some of that work out of the system, that lets people be people and do what they really want to do and what they got into healthcare for. No doctor or nurse ever went to school to say, gee, I can't wait to type into Epic today. They want to, I want to save people, I want to help people, I want to make people better, and everybody wants to do that.
Mhm.
Yeah, I mean, Crystal, when is this going to be ready? Because this is exactly the way I want to have a healthcare experience. And Obviously, we know I would love to move back to Charleston. So here's another reason. But yeah, would love to hear how you're ballparking, the full implementation of this incredible vision.
It's going to take some time because not every single piece of this is ready yet. We're doing a lot of work on our provider schedules to make them more accessible, more open, so that you can schedule yourself. Stacking those tests or whatever you need is a second piece. Working with insurance providers and having some sort of robotic process automation that actually goes out and checks to see if this test is going to be covered, or then notifies your doctor if it isn't, so that they can decide what they're going to do next. There's a lot of things that play into that: the workflow, the change management. What tool can do that, or is there a tool that can do that? Changing the hospital room of the future. I'm sure you guys, there's a lot of talk about that right now, and trying to figure out when in the right place and what tool should be in there is a whole science unto itself. And should we retrofit our old hospitals? Should we set up our new hospitals that way? How do we know what technology is good, what that will last a long time? A lot of variables there.
How do you balance the cost with the return on investment? What's your philosophy there?
Some things are table stakes. We're going to have to do. You've got to make sure that you have Wi-Fi everywhere, because all these tools need that. For example, that's a table stake. Some things are, we need to have, we want to have, we have to go forward. But, we never install a tool unless there's a true ROI, and we watch those things. Like, why would we put this in? Not just to be the cool kids on the block, but are we cutting down time? Are making things easier? Are we getting bills paid faster? Are we making provider schedules more available, cleaning up their no-shows so that they can be more productive in their day, cutting down staff time? We know that doing pre-check-ins, we save every department that we use, or notable pre-check-in, saves about 7 hours a month on handing the clipboard and taking the clipboard back on those check-ins. So that means that Sally at the front desk can actually look up and go, "Oh, Mrs. Smith, how are you? What else can I do for you today?" Because they have that time, because they're not constantly pushing on all these other things. Putting in a voice bot in our call centers is going to help take the low-hanging fruit. That, can you confirm my appointment? I need to cancel my appointment. Do I need to wear a mask? Where do I park? Those kinds of things can be answered by a voice bot, and then let our patient access center personnel help you schedule a really difficult series of events until such time as it's automatic overall for those types of things.
Crystal, on ROI, just to get even into the weeds, how detailed does the calculation get? So if it's 7 hours a month of saved time, do you multiply that by the salary, and then you add the profitability of the outcomes, and then you put that over the cost of notable? Or how do you all benchmark ROI, I guess is what I'm trying to get to.
It depends tool by tool, and there's some secret sauce in there, and I can't go deep into that because it's our finance people.
Sure.
But depending on what you're doing, you have to take into account, if I'm going to be creating, an online scheduling platform for, 1,000 more appointments a month, that's great. But do I need to then have a doctor that's going to fill those appointments? And if so, then I've got to take in the cost of the salary and the overhead and everything else to fill those appointments, if I'm going to put those appointments out there, for example. Or are we saying those 1,000 appointments are appointments that are already available in the provider schedule and they're just not being utilized? That's a different calculation. But we usually have 2 or 3 really strong ROIs that we, per project, that do have monetary ties back that we can do.
Very cool.
Excellent. Wow. So we talked about what you're excited about for the future. What about your concerns? I think it's always important to discuss the concerns that we have with where technology is going.
Security, obviously. That's on everybody's mind. There's the smarter that AI gets, the better that the bad guys are going to be able to hack things. So we have to be super smart. Talk about AI. We have to talk about, how we're going to use it, how we teach people to use it, how do we make people smarter to use AI, and, validate the results. We like to say there always has to be a human in the mix. We'll never have AI without having a human review it. We have Epic's AI generated in-basket messages, but we would never send a message to a patient without a provider looking at it, for example. We have nuanced DAX. So that's ambient technology that allows me as a doctor to talk to Ken and go, "Okay, tell me about what's going on today. I'm going to record it on my phone." And then it types all my notes up for me. But I still read the notes to make sure that it's correct. And sometimes, they can be off a little bit. We have to be validating and training our models on patient populations that are like our patients. If you look at it and it's all white men from 35 to 45, that's not our patient population.
Mhm.
And so it may give a different determination of where you might want to take whatever this AI is going, whether it's filling out a job description or review for someone, or a treatment plan might be different for that. And so we have to make sure that it's matching accordingly. The integration, we've really got to figure out how to make these tools integrate better and faster. It takes so long to get these things, once you buy them, to get them integrated in. And our IT people are overtaxed and there's not enough of them.
Mhm.
And I don't know of any system that says, we got plenty of IT, no big deal, give us some more project. So we've got to figure out how to make sure that we're smart about how much we're introducing, because they need to be at the table as well, so that they can, weigh in on it. That's going to take a long time. That's not going to take a long time. That doesn't match, and so on. I'm pretty lucky because my CIO and I see very eye to eye on some of this stuff. So he's a great partner.
That's great. So a lot of planning, just evaluating. I appreciate the comments about health equity. That's something that we've definitely been talking about a little bit more on the podcast, and just how important that is, and really just the importance of getting AI to the point where it is providing some of that equity and understanding the differences in population. So I think that's really important as well.
What's the call to action to people within healthcare IT? Maybe just a general like mindset, or what we can be thinking about, to bring the more life to our day-to-day work, if you will.
I think there's a couple of things. One, always keep the consumer at the center. We say patient, but really they're a consumer because they can choose to go wherever they want. And healthcare is more accessible than it was before. You can choose to go to the hospital in the next town. You could choose to drive several hours to go to another hospital if you want to. You can get it online at Amazon sometimes. So we have to make sure that we're satisfying our consumers and getting them what they need. And that most of the time is just to get in to hear somebody or see somebody. And that's really important. We also have to make sure that we don't, as technologists, make more work for our care team members. They have a lot on their plate already. And if we make it hard for them to use the tools, they're not going to use the tools. So it's important to make sure that you're working with them, updating the workflows, making them partners, getting champions in those areas so that they can explain how they've fixed their schedule, whatever it is, or they use this tool this way. I mean, it actually does make a difference. If we're just adding something in so that we can track more metrics or something, that is definitely not going to make it any better. And so I think we have to think about taking care of our patients and then taking care of our care team. And if we're doing those things, I think we're making a difference in healthcare on both sides.
Thanks again for listening to Quick Hits, a healthcare technology podcast for healthcare technology professionals. Follow us on Spotify or Apple Podcasts, and don't forget to reach out to us with feedback, suggestions, or even people in the healthcare technology industry you think we should interview. Send an email to quickhits@healthdatamovers.com.